Would you trust a robot to perform surgery on you? I mean, it's a pretty crazy thought, right? But that's exactly what we're diving into today, AI in a robotic surgery.
Yeah, it's definitely a question that's on a lot of people's minds, especially with all the advancements we're seeing.
Right. So we've been going through all these articles and research papers, and wow, it's clear that surgery has come a long, long way from the old days of just scalpels and sutures.
It really has.
But where are we going? Are we talking about like robots fully replacing surgeons?
Not exactly. It's more about evolution, not replacement. I mean, think about it. Surgery has always been about pushing those boundaries, making things better for the patient.
Makes sense?
We went from antiseptic techniques to minimally invasive procedures. It's all about making surgery safer and more effective.
Okay, so how does robotic surgery fit into all of that? I feel like we've all seen those sci-fi movies, the ones with robots doing all these crazy complex procedures. Is that what we're talking about here?
Well, the reality might be closer to science fiction than you think.
Yeah.
Take the Da Vinci Surgical System, for example.
Da Vinci System.
Yeah.
I've heard that name before. To be honest, it sounds kind of intimidating. What's so special about it?
It's like a surgeon's high-tech extension.
Yeah.
I mean, imagine incredibly precise movements, no hand tremors, and this amazing magnified 3D view of everything they're doing.
Okay, so steady hands, better vision, that makes sense. But I'm still not getting the AI part. How does AI fit into all of this?
Well, AI takes things to a whole other level. Picture this.
Hmm.
We've got a neurosurgeon, right? And they're operating on a delicate brain tumor.
Yeah.
AI can actually analyze data during the surgery, in real time.
Wow.
It compares it to tons of other cases, offers the surgeon insights they might not even be able to see.
It's like having a supercomputer as your co-pilot in the operating room.
Yeah, exactly.
Mm.
It can help with decision-making, suggest the best path, all based on data analysis. But, and this is important, the surgeon is still the one in control. Always.
Okay, that's reassuring. So it's like it's a tool, not a replacement.
Exactly.
But I can't help but think, isn't there a risk of becoming too reliant on these systems? Like, what happens if something goes wrong with the AI?
That's a valid concern. Surgeons need the right training. They need to understand what AI can and can't do. It's about enhancing their skills, not replacing them.
One of our sources actually talked about how AI can eliminate those tiny little hand tremors that all surgeons, even the best ones, have. And I'm thinking, even I get shaky hands when I'm trying to thread a needle. So I can only imagine how important steadiness is in surgery.
Oh, absolutely. Even the most skilled surgeon can benefit from that robotic precision. And that precision, it opens up all sorts of new possibilities.
Like, what kind of possibilities? What are we talking about here?
Think about microsurgery.
Okay.
With AI and robotics working together, surgeons could operate on a much, much smaller scale. We're talking about repairing tiny blood vessels, nerves, even operating on fetuses while they're still in the womb.
Wow. That's incredible. It's like the difference between using, I don't know, a scalpel and a laser.
Exactly. And because AI is analyzing all that data and suggesting the best approach, the chances of success in those delicate procedures goes way up.
So surgeries that were once impossible are becoming, what, routine?
That's the direction we're headed. And it's not just about precision. We've got AI-powered 3D imaging. It gives surgeons a level of visualization they never had before. Imagine seeing a tumor from every angle, rotating it, zooming in, planning your approach with absolute clarity.
It's like having X-ray vision. That's got to be a game changer, especially for those really complex surgeries.
It's as close as we've come. And AI is always learning, always improving, so the possibilities are, well, pretty remarkable.
But with all this talk about AI and robots, what about the surgeon? Are they just going to be sitting back watching the robots do their thing?
That's the big question, and it's something we'll definitely explore more in part 2 of our deep dive.
All right, so before the break, we were talking about this fascinating partnership between the surgeon and AI in the operating room. But I'm still trying to picture, what that actually looks like. Are there real world examples of this happening already?
There are. In fact, one of the studies we looked at talks about using AI to analyze colonoscopy images.
Okay.
And get this, the AI was actually able to detect polyps, which, as you know, can be precancerous, with a higher accuracy rate than human doctors.
Wait, so you're saying the AI was better at spotting these polyps than the doctors?
In this particular study, yeah. It had been trained on so many colonoscopy images that it was really good at picking up on subtle things that a human eye might miss. But here's the key. The AI wasn't replacing the doctor.
Right.
It was more like a second set of eyes, flagging things for the doctor to double-check and make the final call.
Oh, okay, so it's like an extra layer of safety. Makes sense.
Exactly. And that's just one example. I mean, AI is being used to analyze scans, predict how a patient might recover, even guide surgical instruments in real time.
Okay, so let's talk about the future. Our sources mention, fully autonomous surgical robots. Are we really talking about that happening? Or is that still just science fiction?
It's closer than you might think. Researchers are already developing robots that can do some basic surgical tasks on their own. Like, suturing is one area where they're showing some pretty remarkable dexterity.
Hold on, are you telling me a robot could, like, stitch me up after surgery? I don't know about that.
I get it. It's a big step to trust a machine with something as delicate as surgery. But think of it this way. Wouldn't you want the most precise, steady hand possible working on you? A robot, it doesn't get tired, doesn't shake. It could potentially do an even better job than a human surgeon, even a really experienced one.
I guess that makes sense, but where's the surgeon in all of this if the robot's doing all the work?
That's the million-dollar question. The surgeon's role in this, fully autonomous scenario is still being debated. Some people think surgeons will be more like supervisors, overseeing the robot and only stepping in if something really unexpected happens.
So like a pilot with autopilot, but for surgery.
Yeah, exactly. The AI handles the technical stuff, but the human surgeon, they bring the expertise, the judgment, the ethics.
Okay, that makes me feel a little better. So it's not about replacing the surgeon, it's giving them a more advanced set of tools. But what about, the human connection, the empathy, that sense of caring that you get from a doctor? Can a robot do that?
That's a great point. And it's something researchers are working on, actually. Some are trying to give robots more human-like features, so they can communicate with patients in a more natural way.
So we could see robots with, like, faces and voices, expressing empathy, maybe even cracking a few jokes. Hard to imagine that.
I know, right? But robotics is moving so fast, what seems like science fiction now might be normal tomorrow.
Okay, let's say we do get to that point where robots can do surgeries on their own. Who's responsible if something goes wrong? The programmer, the hospital, the robot.
That's a tough one. It's a question that's keeping legal experts up at night. The whole liability issue is a major hurdle that needs to be sorted out before we see these robots everywhere.
Wow, so it's not just technical, it's a whole new set of ethical and legal challenges. One of our sources brought up this idea of, a healthcare divide. Like, if this technology is so expensive, will only rich people be able to afford it?
That's a really important concern. We have to make sure access to these advancements is fair for everyone. Otherwise, you end up with a two-tiered healthcare system, one for the wealthy and one for everyone else.
That's a scary thought, like something out of a dystopian movie. We have to make sure this benefits everyone, not just a select few.
Absolutely. And that's going to take careful planning, ethical guidelines, a real commitment to making sure resources are distributed fairly.
Okay, so we've talked about robots doing surgery on their own, the liability issues, the potential for things to become unfair. But what about the potential benefits? Are we talking about a future where surgery is faster, safer, more effective for everyone?
That's the hope, right?
Hmm.
Imagine a world where complications are rare, recovery is quicker, even the most complicated procedures are done with amazing precision.
It sounds almost too good to be true, but is that really where we're headed?
We're at a turning point, that's for sure. The technology is moving so fast and the potential is huge. But like we've been talking about, there are some big challenges that need to be addressed.
Challenges that go beyond just the technical stuff.
Yeah.
We've got to think about the ethical side, the social impact, the economic side of it all. It's not just about making better robots. It's about building a better future for healthcare.
Couldn't have said it better myself. And that's a conversation we need to have as a society, an open and honest one. Weigh the potential benefits against the risks and make sure these advancements are used responsibly.
Okay, we've covered a lot here, from how these AI-powered robots work to all the ethical and social questions they raise. But there's one thing we haven't really gotten into yet: nanotechnology. Our sources touched on it, but it sounds like something out of Star Trek. Tiny robots working inside the human body? Is that even possible?
More than possible. It's already happening. Nanotechnology is a booming field, and the things they're doing with it in medicine are incredible. We're talking about robots so tiny, they can travel through your bloodstream, target specific cells, deliver drugs with pinpoint accuracy.
Whoa, so not just robots assisting with surgery, but robots doing microscopic procedures inside the body. That's just wow.
Right. Imagine treating cancer at the cellular level, repairing damaged tissues with nanobots, even monitoring your health in real time with microscopic sensors.
It sounds like science fiction, but are we talking like soon or is this decades away?
It's hard to say for sure. Nanotechnology is still young, but it's progressing amazingly fast. They're seeing promising results in labs, and the potential in medicine is huge.
Okay, my mind is officially blown. This whole conversation has been incredible, all these future possibilities. It's just amazing. But before we get too lost in the future, let's take a breath and think about what it all means. If we're talking robots, doing surgeries, delivering drugs, operating at a microscopic level, what happens to the human doctor? What's their role in all of this?
That's the big question, isn't it? And it's something we'll explore in the final part of our deep dive.
So we've been talking about this future where robots are, performing surgeries, delivering drugs, even working at the microscopic level with nanotechnology. It's pretty mind-blowing, but it also makes you think, what does it all mean for doctors, for human doctors?
It really does. As we move into this new era of medicine, I think it's so important to remember that technology should be there to make human care better, not to replace it.
Yeah, one of the things that really stood out to me in all our research was this idea of the surgeon becoming more like a conductor of an orchestra, leading a whole team of technology. I thought that was a really interesting way to put it.
It is a very powerful image. I mean, a conductor doesn't play every instrument, right?
Right.
But they understand how each part fits into the whole symphony.
Right.
In the same way, maybe a surgeon in the future won't physically do every single step of a procedure,
Yeah.
but they'll be the ones orchestrating everything, guiding the process, making those big decisions based on their expertise.
So it's not about just handing it all over to the robots.
Exactly.
It's about using their capabilities to get the best possible results for the patient.
Exactly. It's about creating that perfect partnership
Hmm.
where technology and human skills and intuition all work together.
But if we're being honest, there's still that part of us that needs that human touch,
Of course.
that reassurance of a doctor's hand on your shoulder. Can a machine ever really replace that?
That's the challenge, isn't it? We can't just ignore how important empathy and compassion are. That human connection is so important in healthcare.
Yeah.
Robots, well, they might be great at the technical stuff, but they've got a long way to go before they can really understand and support someone the way a human doctor can.
Which takes us back to that question we asked before. What happens to the medical profession in all of this? I mean, things are changing so fast.
Well, I don't think the role of the doctor will disappear. Not at all. I think it will evolve.
Okay.
As technology starts to take on more of those technical tasks, doctors will have more time to focus on the things that really need a human touch.
Like what kinds of things?
Communication, empathy, making those complex decisions that require, human judgment.
So maybe we'll see doctors spending less time in the operating room and more time actually talking with their patients,
Exactly.
discussing different treatment options, giving them support, really being there with them on their healthcare journey.
Yes. Technology can free doctors up to focus on that human side of medicine, building those relationships with patients, and providing truly holistic care.
That's a future I can definitely get behind. So it's not robots versus doctors.
No.
It's about finding the best way for technology to help both patients and healthcare professionals.
I couldn't agree more. It's about using the power of technology to create a healthcare system that's, more efficient, more effective, and ultimately more focused on the human being at the center of it all.
Well, we've covered a lot of ground in this deep dive, from the amazing technology of these AI-powered robots to the really complex ethical and social questions they bring up. It's clear that we're entering this whole new era in medicine, one that has the potential to be incredible.
Absolutely.
But we also need to be thoughtful to consider all the implications, the ethical side, the social side.
Absolutely. We need to approach these advancements with, well, a healthy dose of caution.
Yeah.
Ask the tough questions, have those open conversations, and make sure technology serves humanity.
Well said. So to all our listeners out there, we hope this deep dive has given you a glimpse into what the future of surgery might look like and maybe sparked some interesting conversations of your own. This future, it's being shaped right now, and we all have a role to play in making sure this technology is used for good.
Keep exploring, keep asking those questions, and keep diving deep into this amazing world around us.
Thanks for joining us on this journey into the future of healthcare. Until next time, stay curious, stay engaged, and stay tuned. This is going to be an amazing ride.